Hi, my name is Satori Gibson, and I'm your Philadelphia Medical Reserve Corps Volunteer Coordinator. Thank you for taking the time to watch this new volunteer orientation training. And we're excited to have you as a Philadelphia MRC volunteer. The agenda for this orientation is as follows. We'll start off with an overview of public health emergencies, followed by some MRC history and useful information. I'll then talk about trainings and deployments. I'll go a little bit more into some MRC partnerships we've developed over the years. I'll talk about eligibility criteria for potential volunteers. I do like to talk about the benefits of volunteering. I'll speak more to the volunteer deployment process and other useful information pertaining to that. And then finally, I'll wrap up with some response deployments we've done over the years. And then I'll touch on some volunteer highlights as well. So before we can deploy any volunteer to respond to a public health emergency, it's important for us that we know you're able to identify what a public health emergency is. So, what is a public health emergency? Well, a public health emergency is defined as an event that threatens to overwhelm routine public health and healthcare activities due to scale, severity, timing, or unpredictability. All right, moving on to some MRC history. So if you didn't know, the first MRC unit was actually founded in 2002 following the attack on the Twin Towers on September 11th of 2001. Just a few years later in 2005, the first Philadelphia MRC unit was founded after the realization was had that we needed our own massive workforce of individuals living in or near Philadelphia who were trained and ready to respond if and when called upon to help support efforts to relieve emergency disasters, other large-scale events occurring in and around the city, or any other natural disaster that may affect Philadelphia. We've proudly been serving the city ever since 2005, but the response that we're most proud of to date is when we were called upon in March of 2020 to respond to the global pandemic of coronavirus that took the world by storm. And we've been serving the city ever since to combat this deadly virus. I'll speak a little bit more later on about some of the efforts and response deployments that we've done in order to combat COVID-19. But first, I just want to give you a general overview of what the MRC looks like on a national basis and dive a little bit more into what's unique to our specific unit here in Philadelphia. So here's just a visual image of a map that represents roughly 800 community-based MRC units that are spread across the nation. As you can see, the units are fairly widely spread, and we even have units in Hawaii, Guam, Palau, and even Samoa. Now, I talked about how there are a few things that make our unit unique. But before I dive a little bit more into that, I do just want to say I'm very, very proud to announce that we have over 7,000 volunteers, ranging in professionals' careers from physicians to EMS professionals, non-public health professionals. We have students from all backgrounds. We have teachers and many other Philadelphians who are just eager, empowered, and passionate about being a Philadelphia MRC volunteer. And I think that's one thing that makes our unit very unique. All right, so here's just a visual image that breaks down some data. So from 2020 to 2022, we've grown a lot, and I mean a lot. Since our COVID-19 response, we've actually increased our volunteer count by over 148%, and that number has not slowed down as we continue to recruit new volunteers every day. We've been able to log over 16,000 MRC volunteer hours just from the past 2 years alone, and that speaks a lot to the dedication of our volunteers to every deployment that they've been called upon to respond to. And who doesn't love some partnerships? Without partnerships, we would not be able to do the work that we do in such an efficient manner. So I do just want to highlight a few of them. We have a strong partnership with the Office of Emergency Management. who frequently helps us transport some of our logistics and supplies to and from certain sites of deployments that we do. We have a very strong partnership with the Philadelphia Police Department, who we proudly serve, and we provide them with 3 annual flu clinics every year as an exercise for our volunteers, clinical and non-clinical, to practice skills if and when called upon to inoculate first responders in the event of emergencies. And then we also are building a very strong relationship with the Philadelphia Fire Department as we support them side by side in their medical tents at any large scale special event in the city. So whether that be the Philadelphia Marathon, the Broad Street Run, Made in America, or any other music festival or concert that tends to occur in Philadelphia, we're right there alongside the fire department to help support them in any medical or non-medical capacity that they may require. All right, so I talked about eligibility criteria a little earlier, but I'm going to go a little bit more in depth of what that means. So in order to become a Philadelphia MRC volunteers, you have to check off a few boxes. The first being, we do have a strict age requirement. All volunteers must be 18 years of age or older. You must legally be an adult in order to volunteer. You must live or reside, in or near Philadelphia. Temporary residents or international students are included in this as well. We are very inclusive, but in order to actively and effectively respond to any emergencies we're called to deploy volunteers to, we need to ensure that volunteers are able to respond rapidly, which means living in or very, very close to the city is very important when we determine who we're going to deploy for certain responses. And then, of course, all volunteers have to register on ServPA. That is our state emergency registration system in Pennsylvania. And I have a separate training on ServPA and how to navigate that system, how to update your profile, how to register, how to include some of those required identity information that we do ask from you. So that is a separate training that is also available. And you can find that training on our Philadelphia MRC YouTube page. But all volunteers must go and register on ServPA. That is how we send out messaging to all of our 7,000 plus volunteers. That is how we effectively communicate. That's how we run your licenses. That's how we do background checks. That's one of our essential programs and systems that we operate in and out of every day. And then in order to become a Philadelphia MRC volunteers, once volunteers register through ServPA, they do then have to pass a criminal background check. All volunteers have criminal background checks ran on them just to ensure that we are recruiting the best of the best. Obviously, we want very upstanding citizens and individuals to serve us as volunteers and to be part of our unit. So we just do our due diligence and make sure that we are just accepting the best of the best and those with the best intentions. So that is what any criminal background checks are about. And if you have any questions about anything that I've touched on thus far, you can always feel free to email and contact us at mrc@phila.gov, and we'd be happy to answer any questions you may have. All right, here's my favorite part of this orientation. I love to talk about the benefits of volunteering because there are quite a few. So the first would just be gaining skills. You have the opportunities to build and expand upon your skill set, whether you're clinical or non-clinical, or you want to be clinical, or maybe you're clinical and you want to do some non-clinical roles. There is a role for everybody to fill. We have deployments that require clinical volunteers from nurses, physicians, RNs, LPNs, all the different types of clinicians. And then we have non-clinical deployments that call for maybe like teachers or more administrative workers or things like that. So there's definitely a place where everybody can fit in within the Philadelphia MRC unit for sure. And then I talked about, having those opportunities to build and expand upon your skill set. That comes from the deployment experience that you gain from being one of our volunteers. You have the experience to kind of gain a background on a variety of different topics, depending on your interests. We've done flu clinics, we've done COVID-19 clinics, we do community outreach. We do a lot of different things to kind of keep our volunteers engaged and to kind of give back to our volunteers and give you that, experience and those skills and that education that you can take with you further in life. Speaking of trainings, we do have certain trainings that offer free continued education credits for licensed physicians, nurses, social workers, EMTs, and pharmacists. We do always specify when we're offering these specific trainings to volunteers so that you're aware of those opportunities beforehand. Moving on to networking, through volunteering, you'll have the opportunity to meet a lot of like-minded individuals who share interests. So in this picture, this is actually a mother and her son. We have Pat Khan and Tariq Khan. They are amazing, phenomenal individuals and just amazing volunteers. Pat actually got her son into volunteering and they've been with us as a duo ever since. And then just a lot of individuals with similar stories like theirs, whether it's a family volunteering together, whether it's neighbors volunteering together. You know, we've had colleagues volunteer together and things like that. But it's a huge networking opportunity for anybody who's interested in meeting other individuals who share interests in terms of public health or emergency disaster management or emergency response or things like that. All right, and the two favorite things that everyone loves when they come to any event or training or anything that we kind of offer to our volunteers are the giveaways. So whether it's a deployment or whether it's a training, we do typically give away a lot of free preparedness materials like emergency to go kits. We do offer, like I said in the previous slide, the continued education credits or the continued education units that you can gain from certain specific trainings that we offer. So those are our two biggest things that we like to push for volunteers because, again, we want to give back to those who are giving to us. We do understand that volunteers are very dedicated and responding and going to deployments and giving back to their city and to their communities. So we do our best to give back to the volunteers as well. And then one of the best ways we can do that, aside from giving you free materials, is also to give you some education so that you can take that information and disseminate that amongst your own communities within your own network of individuals. You can share that information with your family, your friends, your coworkers, and things like that. And that the knowledge that you gain from those trainings can really prove to be beneficial later on in life. All right, now we're going to get more into talking about the volunteer deployment process. So, I spoke a little bit more about CervPA and what that was. So like I said, in order to be a volunteer, you have to, it is required, you have to register in CervPA, specifically under the Philadelphia MRC unit. That is because there are, like I said, earlier in the presentation when I showed you that map, there are a lot of different MRC units spread across the nation. And so it's very important when you register with us in CervPA that you specifically register as a Philadelphia MRC volunteer. Following registration, after you pass your background checks, you'll then be able to begin receiving deployment opportunities. So based on the request for volunteer support that we receive, we then put together surveys and we ask you for your availability. And we basically gauge your interest and availability for specific deployments that we're putting together based off the data that we collect from those surveys. And then after we determine who would be a best fit to deploy for those different types of deployments, we will then send you your deployment survey or your deployment email, and in that deployment email, you'll get all the different, types of information and anything like that pertaining to that specific deployment. So you'll have your point of contact, the location where you're supposed to meet, the time frame or the duration that your deployment is supposed to last until, and all that particular information. All volunteers do have to accept the deployment. Regardless of whether you filled out a survey saying, hey, I'm available on Tuesday. If we email you and say, hey, we want you to volunteer on Tuesday and we don't hear back from you, unfortunately, we're going to reach out to someone else because we didn't get that confirmation back from you. So it's always important to keep an eye on your inbox. If you are selected to deploy for a specific deployment opportunity, you will receive a deployment summary, and it's very important for you to write back to us and respond and saying that you either accept and or decline that deployment so that we can staff accordingly. And then once you arrive on site for that deployment, if you then chose to accept it, you will be asked to sign waivers. So all new volunteers must sign both a liability and confidentiality waiver before volunteering. That is for your protection and for ours. Any questions about waivers can be directed to myself specifically. You can email mrc@phila.gov with any questions about that as well. Or if you run into me on site or the day of your deployment, I'd be happy to go over any details about the volunteer waivers and things like that with you. So never, be afraid to ask. You can always, and we do encourage everybody to read them thoroughly, front and back. It's a double-sided document. And again, like I said, if you have any questions, you can always come to me or your point of contact for that deployment and ask them about that, and they'll be able to give you some answers. All right, so after you arrive on site, you get signed in, you sign your waivers, you will be provided on-site training. We call them JITs, which is just-in-time training. You will receive basically an overview of what your roles and responsibilities are outlined to be for that specific deployment, which leads to my next topic of acting within your scope of practice. It's very important that once your roles and responsibilities have been outlined for you, that you do not step out of those roles and responsibilities. Please kind of, stay in your lane. Everyone has a job to do, and we are most efficient when we all work together and do the thing that we were tasked to do. So in terms of scope of practice, this is, particularly for the non-licensed, non-medical volunteers. It's very important for you to know that if you are, deployed to support a clinical activity like a flu clinic or a COVID-19 vaccination site, that if you are deployed as a non-medical volunteer, that means you cannot perform any medical or clinical tasks. Only licensed medical volunteers are able to do those things. And then even those clinical volunteers must stay within their scope of practice. So we have a wide variety of volunteers with a very wide background in terms of careers and professions. And so while we understand that we have physicians, we have nurses, we have very experienced individuals who are also our volunteers, we have non-clinical individuals who may have been in administrative work or hospital administration or something like that, where they've done certain things like this before, or maybe they've been in a position where they've done something that's similar to a deployment that they were sent to. However, it's very important to keep in mind, no matter your experience or expertise, we do expect you to stay within your role and only do what is asked of you within your roles and responsibilities. It's very, very important to kind of highlight that. We do not want anybody acting without their scope of practice. That can cause chaos and also cause some confusion and may lead to issues that we want to avoid. So please just kind of stay in your lane, like I said, and act within your scope of practice. So your on-site point of contact. So during your deployment, you'll report directly either to myself as your MRC coordinator, or you'll be designated a point of contact, all of which you will receive that information in your initial deployment summary when you're selected to deploy. You'll be told exactly what their name is, where you should meet them when you arrive on site, what their telephone number is, things like that. So you can always have a point of contact where you can go for any type of information if you have an issue or anything like that. So always be aware that there will always be someone on site the day of your deployment to take care of you, to help you, to guide you, anything you may need. That is your person. And then also, you're always able to reach out to me at any time if you need anything from me personally. You can reach out to the MRC inbox. All the contact information will be put up at the end of this presentation, so you can feel free to venture down those avenues if you need to get in contact with myself or someone else in terms of MRC things. All right, so speaking about any deployment questions. If you have any questions or concerns about your deployment, please always contact us. Please just let us know, whether it's a family emergency or you're no longer able to make it, that's okay. Life happens, we understand. We just want to be prepared if you're not able to make it, if we need to call on someone else, things like that. But please just always ask us if you're unsure whether you're specifically qualified for a deployment, or if you find yourself scrolling through a survey with a list of deployment opportunities, but you're not sure, which one would work best for you or what you would be the best fit for, you can always feel free to reach out to us and we'll just let you know, pertaining to your professional background, your skills, expertise, things like that. We'll definitely make sure that we find the correct deployment for you. So just let us know if you have any questions about your deployment. We're always here to help. All right, so I touched on the scope of practice, in the previous slide. I'm not gonna drill it in too much for you guys, but again, like you said, or like I said earlier, it's just kind of self-explanatory. Stay within your scope, stay within the responsibilities that you were assigned. Like I said before, we do understand that we have a lot of very experienced clinical volunteers with a wide skill set. However, we do require volunteers to kind of follow the assigned tasks during the deployments and kind of stay in their lane and do only what is asked of them unless asked to do otherwise. And again, if you have any questions about this or what this means or anything like this, you can always feel free to contact us or ask your point of contact the day of your deployment. Medical authority. Okay, so medical volunteers, if you didn't know, now you do. All Philadelphia MRC volunteers work under the medical license of the PDPH Division of Disease Control Physician. Actually, right now, that is our acting health commissioner. So all of you clinical volunteers out there are currently working under the medical license of our health commissioner, Dr. Bedical. And so all medical volunteers are permitted to support PDPH events or City of Philadelphia events, along with the fire department, like I said, and their EMS professionals in the medical tents at large scale events like Made in America, the Broad Street Run, Philly Marathon, things like that I mentioned earlier. But it's very important to kind of know where, if you are a medical or clinical volunteer, it's important for you to know where your medical authority is coming from. And if you have any questions about this, again, always feel free to reach out and ask us. Deployment do's and don'ts. This is, my love-hate slide. I hate that I have to go over this, but I love to emphasize the importance of why we kind of need to pay attention to some of these things. So volunteers are only able to deploy once they receive their deployment summary, and this is very, very important. Again, I think anybody who has worked with me in the past, who has volunteered alongside me before, everyone knows I'm not a fan of self-deploying, so please do not self-deploy. It just causes very much chaos, confusion. It's a little too much. I am very big on knowing who is where, just so that I'm very accountable for all the volunteers that I deploy out in the field. So I want to make sure that everyone is where they're supposed to be. Everyone is reporting to who they're supposed to report to. If you're not supposed to be there, you shouldn't be there. Just to make sure that everything runs smoothly, we avoid as much confusion and chaos as possible. And in terms of accountability, knowing who is where is very important. So please do not self-deploy if you are not sure what that means. Again, self-deploying means that if you have not received a confirmation saying, hey, we would like you to come here, don't show up. If you don't receive deployment summary from us saying, hey, we would like you to show up here, don't show up. Basically, if we do not contact you and invite you out somewhere or deploy you out somewhere, please do not self-deploy, stay at home, just wait to hear back from us. If you find that you are signing up for a lot of different events, but maybe you haven't heard back from us, that's okay, just reach out to us, let us know. Again, I'm going to put all of our contact information at the end of this presentation. You can use any of those to reach out to us, and we'd be happy to assist you in the best way that we can. But again, do not, under any circumstances, do not self-deploy. Anybody who self-deploys, we typically do send you home and you will be unable to volunteer for that day. And we don't want, for that to happen. So please, please, please just do not self-deploy. Volunteers must email to confirm if they accept the deployment. Again, I spoke on this a little bit earlier, but this is very, very important. You want to make sure that once you receive that initial deployment summary saying, hey, you have been selected for this deployment, thank you for registering, please respond to us letting us know whether you confirm or deny this deployment. Please do that as soon as possible. That is very important for us to know who is scheduled and staffed where. If we do not hear from you with a confirmation, or if we don't hear that you don't plan on showing up to that deployment, that could cause a little bit of confusion. If we think you're coming, but you're not, then we're going to be short a volunteer. If we don't think you're coming and you actually show up, then we may have one too many volunteers. So please just always communicate with us as best as you can. If you are feeling ill in any way, always stay home and notify myself, your MRC coordinator, or you could just email mrc@phila.gov. That is our central inbox for everything. So if for whatever reason, if you're, not feeling well, or if you have a family emergency or life just happens, please just let us know. We want to also be mindful of any illnesses that may occur if it happens out of deployment. We want to be mindful of the close contacts who were there that day or things like that. So please just let us know. If you aren't able to make it, we'll understand. We would like to know what's going on. Especially if you're ill and you feel as though you may have contracted that either at a deployment or, if you feel ill after deployment, please let us know so that we can notify close contacts or things like that. We just want to make sure our volunteers are as safe as possible. Your safety and health is our top priority. So please always notify us if you have any health concerns. All right, so the don'ts talked about never deploying. Sorry, I talked about never self-deploying. Another don't is please do not no show, no call. That also causes chaos and confusion. We very much bank on volunteers showing up. And if you do not show up, we may be, short-staffed, and we don't want that to happen. So please let us know if for whatever reason, whether you're not feeling well, like I said, family emergency or life happens, please just let us know if you're not able to make it. But yeah, please just don't no show, no call. And then I'm not gonna go into this again, but don't go outside your scope of practice or represent or misrepresent the MRC in any way. We talked about this. Just stay within your lane, stay within your scope, adhere to your roles and responsibilities. All right, so here are some response deployments and other just general deployments and special events that we've done from 2020 up until 2022. So we've done everything pretty much COVID related, from testing to isolation and quarantine. We've canvassed and disseminated information about masking when the 6 feet social distancing was big. We did some business canvassing and just disseminated, materials like PPE and other things like that to local businesses, eateries, and other retail businesses as well. We are very, very experienced with a variety of different type of vaccination deployments. We've vaccinated, for flu, for COVID, for hepatitis. I think right now we're providing vaccines for pneumonia. So it's just, we have a lot of different avenues where you clinicians can vaccinate if that's something that floats your boat, if you're interested in doing that. And we do annual flu clinics every year with the police department, as I mentioned earlier in the presentation. So like I said, if you're a vaccinator, if you're someone who's interested in that, have experience vaccinating or want to gain experience, look out for those type of deployments that we have coming up. I think one of the most impactful responses we've done thus far was the Operation Allies welcome response that we did at the Philadelphia International Airport. That's actually not pictured on this slide, but we were a part of the efforts that made it possible for those 25,000 plus Afghan evacuees and their families to kind of come through the Philadelphia airport, be screened and triaged, tested for COVID, things like that. And that was a very emotional, humbling, and like I said, overall impactful response that myself and other very, very wonderful volunteers had the opportunity and the privilege to be able to do. And then we also disseminated, I think, a little over 24,000 COVID-19 rapid at-home testing kits between, I think, December and January of 2021. But all of these efforts, in addition to some that aren't pictured here or didn't make the list, allowed us to save the city of Philadelphia over $690,000. And that is entirely thanks to MRC volunteers. You guys go above and beyond. The volunteers that I've had the privilege to meet and work with have just been amazing people. And I'm so privileged and proud to be able to do this work and to continue to working along, all of you. And this is why I love doing what I do, because I get to talk about just the wonderful things that MRC, specifically Philadelphia MRC volunteers have done. And I spoke about how we're unique. We're unique in the fact that we have a very diverse and inclusive pool of volunteers. We have done a variety of different deployments that a lot of other units haven't done. We have a lot of volunteers with a varying range of professional experience. Just there's a lot of different things that make the Philadelphia MRC unit unique in comparison to other MRC units across the nation. And we're very proud to call Philadelphia home. We're very proud of the volunteers and the work that everyone has done thus far. And we're very excited to kind of push forward and see what comes next. All right, so here is just some testimonies from some very wonderful MRC volunteers who have deployed with us throughout the COVID-19 response. I'm just going to give a shout out to one in particular. The bottom right gentleman in the blue shirt that says Philly on it is actually one of our pediatricians, and he has done almost every COVID-19 related response deployment that we've done thus far. He is very much into canvassing. He loves to do flu and COVID canvassing, just talking to Philadelphians and other members of the community about why it's important to get vaccinated and things like that. I'm going to go and talk a little bit more about some other individuals on this slide, but right above Dr. Freeland, in the goggles, the glasses, and the double mask is Amina, and she is amazing. She's one of our nurses. She's also done numerous COVID-19 related responses with us, in addition to some others. She comes every year to our flu clinics when we inoculate first responders and their families. And you can just read her testimony. She's done a number of things within her own public health career as a professional. But she continues to give back to her city by being a volunteer with the Philadelphia MRC. And we're just so thankful to have her and other wonderful individuals like her. All right, so I'm done talking at you. This is the time where you can jot down any of the contact information that you may need. You can feel free to reach out to us at any time with any questions, concerns, or additional information that you may require. You could go to www.serve.pa.gov and register to become a Philadelphia MRC volunteer if you haven't already, or you can just go there to update your profile if your licensing or credentials or anything like that may change. You can reach me, Satori Gibson, at 215-685-4442. If you need to speak to me for anything, please leave a message if I don't answer though. And you can also always email us at mrc@phila.gov if you may need anything as well. And please follow us on LinkedIn. We are active. You can also go on there and look for any upcoming deployment opportunities, any volunteer highlights. I love to brag about my volunteers. So any chance I get to boast about the work they've done, I will do that. So you can check all of that out on our LinkedIn page. Thank you so much for your time and your attention. And even more so, thank you for your interest in becoming a Philadelphia MRC volunteer. I hope to connect with you soon. And thanks for your volunteerism. I hope you have a wonderful rest of your day.